Hello everyone and welcome to today's session titled Rides That Save Lives. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either via phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your the audio pane of your control panel. You will have the opportunity to submit your text questions to today's presenters by typing them into the questions pane of your control panel. Feel free to send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Lindsay Goldman, CEO of Grantmakers in Aging and moderator for today's webinar. Lindsay?
Welcome and thank you for joining us today. As Cody said, I'm Lindsay Goldman, the new CEO of Grantmakers in Aging. Grantmakers in Aging is a national membership organization of philanthropies that acts as a relevant and responsive network, resource, and champion, amplifying the voices of older people and issues of aging. Our vision is a just and inclusive world where older people are fully valued, recognized, and engaged in ways that matter. Since 2010, GIA has been supporting efforts to make communities places where people of all ages can thrive. Our Community Agenda initiative awarded grants to localities across the country, including Age Friendly Arizona, who you'll hear from today, working to become age-friendly, and to develop resources, including Blind Spot, a toolkit around rural transportation programs for older people. We would like to thank the John A. Hartford Foundation for their support of today's webinar. All adults are now eligible for the COVID-19 vaccine in every state. And while older people have the highest rates of vaccination, about 20% of people 65 and older still have not received their first shot. Especially in rural communities, lack of transportation can be a barrier to vaccination and herd immunity. Today's webinar will feature Rides That Save Lives, a new community toolkit from the Rural Transportation Incubator, an initiative of Age Friendly Arizona, sponsored by the Harry and Jeanette Weinberg Foundation and several national partners. Joining us today, we have Amy St. Peter, Deputy Executive Director of the Maricopa Association of Governments, Kent Ellsworth, Executive Director of the Verde Valley Caregivers Coalition, and Suzanne Pfister, President and CEO of Vitalyst Health Foundation. Unfortunately, Earl Millett, Program Officer at the Harry and Jeanette Weinberg Foundation, had planned to be here but is unable to be with us today and sends his regrets. As mentioned earlier, you can enter your questions for our panelists at any time in the question box on the right side of your screen. I will collect these and read the questions during the question and answer portion after the presentations. And now I will turn it over to Amy St. Peter.
Lindsay, thank you so much for having me here today. No one does these webinars better than you, better than Grantmakers in Aging, so we're absolutely thrilled to be able to partner with you. I want to thank everyone for joining in today. We know that you're all extremely busy. We do appreciate the time that you give to these important efforts, and we want to thank you for the impact that you are making on the lives of older adults. The purpose of my comments this morning will be to introduce this new toolkit. We're so excited about Rides That Save Lives, as well as to share one of the stories of courage that are posted as a video in this toolkit. We do hope that you will visit this toolkit. You'll see the address for that right at the top of your screen. Please do take a look at it after the webinar today. We are very excited to be able to share these materials with you and hope that you'll be able to use them in your communities throughout the country. This toolkit then highlights a moment in time. A moment in time, albeit one that's very painful for so many of us. Many of us have lost loved ones due to the pandemic. We've all suffered some degree of isolation and a great deal of uncertainty due to the pandemic in this past year. But these moments in time are also filled with courage, of hope, of bravely addressing these uncertain times and being able to develop a response with those nimble plans, being able to respond to this crisis with creativity, being able to respond to this moment in time by building resilience resolutely and being able to help people. Many of us, all of us, haven't given up. And the reason for that is because people need us now more than ever before. And so with Rides That Save Lives, this is one example of those stories of courage. I know that you have yours as well, and we are eager to learn from you through your questions at the end of this. Through this toolkit, we're able to offer you our stories, our tools, our tips to help us to continue this work even after the pandemic, to be able to respond with creativity, dexterity, in a nimble way, just as we did throughout this past year, to nudge us to reach out to people that maybe we aren't usually working with, but in these unusual times, we absolutely have to partner with them and add value to what they're doing, and to be prepared to receive the value that they bring to this work as well. So we're excited to offer this to you and are eager to hear from your perspectives as well throughout this webinar. Next slide, please. Thank you so much. So you'll see a few of us presenting today, but please know that we're standing on the shoulders of giants, and we walk hand in hand with an army of people firmly dedicated to this work. I want to thank and recognize the partners that you see before you on the screen. You might notice that you'll see folks that, oops, there we go. So you might notice that on the screen, you'll see that we have transportation partners, as one might expect, given that we're doing transportation work, and aging partners, as you might expect, given that we're doing age-friendly work. But you'll also see wonderful partners in philanthropy and healthcare, in regional planning agencies, federal partners, local communities. It really does take a number of different sectors to be able to address people's lives in a holistic way. And so we're deeply thankful to all of our partners for providing this holistic response. All of these partners and so many more are deeply affected by the impact to transportation. And when we talk about transportation, it's not just about the mode like cars or buses. It's about the access to the people and places that matter to us, the people that we love, the places that matter. And we are keenly aware that transportation affects all aspects of our lives. We're also very deeply aware that when we don't have access to transportation, we no longer have access to those people and places who mean so much to us. So this is really about the suffering that people go through when they lose that access. It's also about the lives that are regained when people are mobile, including older adults in rural communities and every community throughout the country. These partners really make this work possible. I'd like to give just a few examples. The Federal Highway Administration, for example, offered us a grant that we're able to use to give our communities a technology stipend. So right now, volunteers in the field who are driving older adults have tablets paid for by the Federal Highway Administration, and they can use those tablets to enter data as they're in the field. This results in less time and less work for the older adult. It also means that we have better access to high quality data, which helps us with our planning. Also want to point out that we're so thankful to the Harry and Jeanette Weinberg Foundation for providing a $300,000 grant. Very thankful as well to our partners who provided $1.7 million in cash match and in-kind contributions. So this is stone soup. This is everyone providing a little bit, their own ingredient to make a soup that everyone benefits from and that nourishes the entire community. Next slide, please. We also want to thank the communities who have made this possible. And this is the list of all of them. These communities have been supported by the Harry and Jeanette Weinberg Foundation through their sponsorship of this work, as well as their technical assistance. I want to thank Grantmakers in Aging for their mentoring of us since Community Agenda so many years ago. They've been mentoring us and a partner to us ever since. And to thank the partners that you just saw in Arizona and beyond who have been helping these communities through the Rural Transportation Incubator, which was launched in 2019. This toolkit then is one of the ways that we're using technology to put resources in the hands of people who need it desperately. And this webinar is one of the ways that we're able to share this work with potential partners and communities across the country. We're very excited to be able to do just that. And these communities, the ones that you see before you on the screen, are the way that we're able to provide rides to older adults throughout Arizona. And thanks to their partnership, to their diligence, to their passion for continuing this work, despite all circumstances otherwise, we've been able to provide more than 36,000 rides to older adults with low incomes throughout rural communities in all of Arizona. And this is only possible because of these partnerships. Next slide, please. So in this toolkit, we're very excited to offer these different elements to you, from videos to models to resource materials and outreach, mobility and access, and vaccines. We're excited to be able to offer this to you because of the work of Elliot Walker through SCP, who is our consultant and close partner in all of this work. as well as with our other stakeholders that we just talked about, the communities, the agencies that are deeply involved in making this work possible. And in just a moment, we'll be sharing one of 6 stories of courage that are present on or in the toolkit through the different videos. And in just a little bit further in the webinar, you will hear directly from Ken Ellsworth. He's the head of Verde Valley Caregivers Coalition, a leading nonprofit here in rural Arizona, really making incredible things happen for older adults in their area. What makes these stories so inspiring and so instructive, though, it's not just about the impressive outcomes that they're achieving. It's about the people who made this work possible. And while extremely talented and committed, these people weren't necessarily, they weren't holding special powers. They weren't specifically empowered to take on these challenges and to make this work possible. They jumped in. They jumped in because they saw dire need and they knew that they could be part of the solution. They knew that they could help to save lives, and so they have. This is also what makes this work possible to replicate it across the country, because in every single community, there are people who care. There are people who want to take action, and there are people who are there ready to partner with you. And sometimes all it takes is for someone to extend that first hand, to extend that first invitation, to say, let's do something together better because we're working together than what we could do on our own. And so it's my pleasure now to introduce you to one of these communities and through the Verde School of Medicine. This is one video that we'll be sharing with you today. We're eager for you to hear the presenters in this webinar, as well as to visit the toolkit after the webinar. But for now, if we can please cue the video, and we'll hear one of these stories of courage. Thank you very much.
Vaccinations, we're going anywhere and everywhere. We get an invitation to go, we go. And so by going to them, which is sort of the real secret, the secret sauce, is just get closer to the folks that need the help. Come in the house. I'm gonna get my shots at everything. It's putting together a team that understands the flexibility and has the skill set to deal with the unique natures of showing up at a place that you don't know what's going to happen. One of the things that we do is we try to carry EMS professionals with us. Occasionally we'll get a student to go with us, whether that's an undergraduate from our university, usually in our honors college, or if I can get a nursing student or a medical student to go with us, we'll take them too. Pair that up with some nurses and some volunteers to help us with the paperwork, and we get a really, really good team. Great community, lovely folks. I mean, they were happy to see us. We were happy to do vaccines. It was a good day. The goal is to keep moving. You know, every time we move that van and get an immunization going, we feel like we're doing what we need to do.
Thank you very much. It is my pleasure now to introduce you to Ken Ellsworth. He is a close partner of ours through Age Friendly Arizona, and he's doing phenomenal work through the Verde Valley Caregivers Coalition. Kent, the floor is yours.
Thank you, Amy. Thank you. And thanks to all of you who've joined this webinar. And I'm Kent Ellsworth at Verde Valley Caregivers Coalition. And next slide, please. I want to just tell you a brief background that Verde Valley Caregivers has been here doing this work since 1993. We got started as a faith in action program way back then, and we now have close to 300 volunteers serving about 2,000 people a year. And we have, all of our programs are based on a call center so that all the people we're serving can call us at any time and let us know what their needs are. And if it's transportation, if it's pet care, tech care, and tech coaching, all of those kinds of things that we do, reassuring phone calls if they're lonely, they need groceries, what's going on in their lives. They can give us a call and we'll match them with a resource. Most of our resources are volunteers, and we have 12 paid staff, and we link people to other services available for them throughout our communities in the Verde Valley region. So this wide spectrum of services, we call them wraparound services, of course, and it really makes a difference for people. The people we serve are unable to drive due to health conditions or advanced age or disability. And their main thing, they want to still live in their own home. They want to live here. This is where they live. This is their house. They don't want to be forced to move because now they need help from their community. So that's why we're here. And when this all came up with COVID, it was a very difficult time. The first pledge we made with our board of directors and our staff is that we're not going to close. We're going to be here. We're going to be here and work through all of this with all the people we serve. We began assisting people with vaccination appointments when the vaccine first came out in February, and providing rides to the vaccination pods. And we've provided rides to about 700 people so far. And we also serve the homebound. Now, Dr. Peak, who's a member of our board of directors, and I sat down, what is the best we can do? What is the very best we can do? We have so many people who are homebound, and it's difficult to get them out to the vaccination pod. Let's do this. Let's work on creating an in-home vaccination, a mobile team. And Dr. Peak developed a relationship with Spectrum Healthcare on our behalf, because we're not a healthcare organization, but we've got the people, we've got the volunteers, we've got lots of retired nurses, just really wonderful people. Let's work together with these resources. So Dr. Peak has been essential in this. Let's take the vaccination to their homes. And then, of course, we've had to commit actually a little bit more than a full-time staff coordinator and some of our other call center folks to actually put this together. Next slide, please. And so we schedule at that point in time, we've assisted well, when we did these slides, it's gone up to almost 700 now. So that we've gotten to local pods and provided nearly more than that many trips to get vaccinated. And on our mobile vaccination teams, we're just slightly below 600 people we've provided vaccination to in their homes. And the process includes creating basically a trip manifest for the vaccination teams and making sure that they're all fairly close by. There is a time limit. We use Moderna vaccine, and once it's thawed out, there's a time limit. We have to get the vaccinations into people's arms within a very limited amount of time. So we can't have that much distance between the homes that we go to. And we do follow-up calls after the vaccination. We do many follow-up calls prior to the vaccination as well. How are you feeling about this? And next slide. And that's one of our vaccinators there, and he is an instructor at the Northern Arizona University School of Nursing. And like I mentioned, we collaborate with Spectrum Healthcare. That's absolutely an essential partnership. And we expect to reach 1,000 seniors, homebound seniors and adults with disabilities with this vaccine in their home. And we're also serving clients that are referred to us from other organizations, such as the Area Agency on Aging. And just as a little note, we've brought on our roles, our clients, 430 new clients in the last 4 months because of their need to get vaccinated. And so it's so many calls too at our call center. And instead of just 1,000 calls a week, we're handling about 2,000 calls a week now through our call center. So it takes a lot of effort and a lot of focus on everyone's part here. Next slide. So our teams go to the homes. It's a vaccinator and a scribe. We have 3 retired physicians and our School of Nursing instructor who volunteers for us. We have 12 retired and licensed RNs who are part of our big volunteer team. Next slide. And what we do is go into the home. We begin with a consent form, and after the consent form is signed and explained, then the vaccination takes place. And then we do the vaccination information form. It's a registration form. Everybody needs to do that so we can track who's been vaccinated how many people and their age have been vaccinated. Next screen. So each home visit for the vaccination takes about 30 minutes. It's about 30 minutes. When we're in the home, oftentimes we vaccinate primary caregivers who are there as well, which is very, very important. We've seen actually one of our oldest clients, who's 102 now, actually got COVID. He got it from a caregiver who came to his home to help him. Thankfully, he survived. And but that's one of the risks. So the risk is, you know, how do we eliminate that risk? It's that more people getting vaccinated, including those caregivers and everybody else. So next slide. Okay, the other thing we do, you remember this, I'm sure, there is a CDC vaccination card, and we fill that out for each person for their first dose and their second dose. And so I think that's really important, that vaccination record card. Next slide. And this little picture, see this? These are our retired RNs, a few of them anyway, getting together for a luncheon we had just a few weeks ago here in Sedona. And they're a part of Narnia. It's a Northern Arizona retired nurses in action. And they're a lot of fun. And we have, of course, retired physicians, and we have a solid staff here at Verde Valley Caregivers, along with our 300 volunteers. Next slide. Now, how do we make this all happen? Really, it starts with not only our vision and mission as an organization, but a solid board of directors. They have lots and lots of talent. I love our board of directors. They actually have decades of experience from, you know, understanding what's underneath a pandemic. What are the numbers? How does this progress? How do we organize ourselves? How do we stay safe? We have experts on our board of directors who can tell us all of these things. And healthcare administrators, a physician, you saw his picture earlier, and RN, a chief nursing officer is also on our board, and people who are familiar with the business of nonprofits and all of those folks. So that makes a big difference. The number one thing I need to get across today is really the collaboration between a nonprofit, community-based services like ours, serving the elderly, is serving with basically wraparound services, and an official healthcare organization. We have to have that joint partnership, and we need to do that not just because of the pandemic. We need to do that forever, because we can help the people that need spectrum healthcare. We can help them with all sorts of other wraparound services that they really need. And also, I'd like to mention the May and Stanley Smith Charitable Trust. They've been stalwart donors of ours for many years and really have helped make this happen. The extra expenses around the in-home mobile teams is covered in part by the May and Stanley Smith Charitable Trust, and also the Arizona Community Foundation of Sedona, the City of Sedona, and the Age Friendly Arizona Network that Amy leads, and also Grant Makers and Aging too. So it really takes that wide range of supporters in order to pull this off and serve so many people just over these last few months. So thank you very much. I appreciate it.
So let me take it from there. Thank you, Kent. Again, my name's Suzanne Pfister. I'm the president and CEO of Vitalyst Health Foundation, which is a health conversion foundation in Arizona that serves all of Arizona. And as they're teeing up my slides, let me kind of go back up to that 30,000 foot level for a minute, and then we'll come back down to see another good indication of the toolkit. As many of you other funders know, There's been so much discussion, and really on a national level, the Robert Wood Johnson Foundation has led that conversation about a culture of health, and that your zip code becomes more important than your genetic code. Excuse me, and this is very clear. This is the Metro Phoenix area, and it shows that there's literally a 14-year difference between the North Scottsdale area, more affluent area, and South Phoenix, which has had historic segregation and historic and systemic racism in that area. So it shows that even in a 20-minute drive, there is a dramatic shift in life expectancy. Next slide. When you start to drill down about why that is, it really is, as Kent and Amy talked about, there's just a variety of factors. And this shows from a statewide level where those disparities occur. And the CDC has a social vulnerability index, and this is an example from our state health department looking at the risk factors, and the darker the lines, the higher risk. But even if you were to take the areas in and among in rural Arizona, you would see disparities even in the metro areas. But it's really important. We were a very traditional health funder when we started, and we have moved upstream to deal with these tougher but equally more important issues. Next slide. And when we look at it, it really has to be this integration of the social conditions. I had a great line in Health Affairs that I saw that a patient said to a doctor, if you really want to help me with my blood pressure, help me with my utility bill, because if it's 90 degrees inside my house, you can throw all the medications at me you want, and my blood pressure will not go down. So it really, as we look about transportation, and that's what we're focused on in this webinar, but it really connects, as Kent said, when someone goes into the house, not only are they looking to make sure they have vaccination, but they're probably doing a falls risk assessment. They're looking at, are there grab bars that need to be installed? Is there adequate food in the refrigerator? And that really becomes a combination of social factors, social determinants that need to be looked at in order to make that person and improve the health and well-being. So transportation is one element, but it also becomes, and it needs to be integrated with these other social conditions. Next slide. What Vitalyst has done is created a graphic, if you will, and lots of other foundations have started using this as a way to show the integration, that health equity is built into this, resiliency is built into this, but all of these different elements go into building a healthy community. And you've seen that in the video, and you'll see that throughout the toolkit. The universities are involved, the faith community is involved, EMS is involved, there's volunteers, there's corporate volunteers, there's retirees. So it is important that whenever you are looking with your grantees to fund these kinds of projects, that you look beyond the traditional access to care and looking how these different elements are connected, because it is very important that you look beyond the traditional. And I'll end with my last slide. For a little bit of humor, it is time to change the rules of the traditional stories. So I would encourage you, as you're looking forward and looking through the toolkit and looking as you are funding other grantees and partners, push them to look at other places. I'll give you a great example. When the vaccines are given out, we usually ask that there be a 15-minute wait, sometimes 30 minutes if people are on blood pressure medicine. I would encourage you to think about using that 15 to 30 minutes to have a conversation about what other social needs are they? Do they have adequate food supply? are they, if they're under 65, but in that 50 to 65 category, are they insured? Do they need to get signed up for Medicaid? Can you, and really, so much of our Medicaid now is looking at social determinants of as well. Our Medicaid in Arizona helps with transportation, helps with access to food, helps with housing supports. It doesn't do rent, but it does housing supports. So it's very important to make sure that people are insured. I affectionately call it the wherever two or more category are gathered category, and that it really is important to look for those non-traditional groups that can connect. Maybe it's the Rotary Club, maybe it's the grocery delivery activities, but taking advantage of those moments when where people are gathered, and that's oftentimes where faith community, even if they're still virtual, they can get the information out for those various services. But using transportation as a conduit to gather and connect people to other social services can be incredibly effective to increasing people's health and well-being overall. So let me turn it back over to Amy.
Suzanne, thank you so much. Really appreciate all of your leadership in this space, and thank you to Kent as well. Really inspired by all of your work and by your ability to bring new ideas and new people together to be able to address some systemic challenges that all of us face in all of our communities. Within the toolkit, we do have a video called Leaders Looking Ahead, and we'd love to share this with you now. It's important to take a look at what we've learned and how we might be able to utilize these lessons for the long term moving forward. So if we can please cue up that video to play now, and I encourage you to settle in, listen, and then Lindsay will be joining us after that to engage us in some questions and answers. Thank you so much.
We have a grand privilege right now because the community is interested in healthcare in a way that's not been interested in my career. So the lessons we learn from this will help us and inform us as we move forward. It's an opportunity, not only personally to serve, but to make sure that the folks that come behind us know how to serve, because we can never pay back the people that helped us get where we are, but we can sure make folks pay it forward.
People are afraid, they feel detached, and they feel abandoned. I think we have a lot of work to do. We have to work with people who people trust in the community. And so in some ways, we borrow their trust. If they trust us, then those doors begin to open in the community. We were in the game a year ago. We started out with testing, working through churches, doing pop-up testing. And so by the time we got to the vaccines, people were at the table, they trusted us, and it's not been easy, but I think it's easier when you're in the game for the long haul, and that's what we intend to do.
I think that we can't ignore the needs, and that's really what it comes down to, is when we see the needs out there, we really need to respond. We're really a safety net for the community. We are essential. As public transit, we're an indispensable part of the city, and you need us and we need you, and I think it's a great symbiotic relationship. It's been really, really eye-opening and awesome.
If we could change anything about our healthcare in this nation for older adults, we need to change that now to make sure every healthcare system, wherever they are, must connect directly with the local nonprofit supportive services that are serving their patients.
So our mission is to enrich lives. And when it all started to come out, that's when I told my staff, I was like, look, we got to figure this out. I just keep on thinking like the next 6 months and the next 6 months, like, because I think this is going to be ongoing. Unfortunately, we're going to have to deal with this every single year. So how are we going to make sure that our people are safe, but have an enriched life? So, that they're not just home all by themselves.
Thank you so much for those incredibly inspiring presentations. If everyone could put their cameras back on, we will now turn to the question and answer period. Okay, I have 2 out of 3 of you.
Oh, sorry. Hit that wrong button.
No problem. Okay. So I would love to start with a question for you, Kent, but a question that's relevant, I think, to channel, which is around partnerships and, developing strategic partnerships that help you reach the people who need assistance the most. And so there's a specific question around whether your relationship with Spectrum Healthcare predated COVID-19, or did it emerge as a result of COVID-19? And so if you could speak to that, and then Amy and Suzanne, if you have thoughts about how to cultivate the most effective strategic partnerships, we'd love to hear about that.
Okay, thank you, Lindsay. And so our relationship with Spectrum Healthcare and with the Northern Arizona healthcare system, a larger system covering Northern Arizona, has been primarily they refer people to us who need rides to get the healthcare appointments. And because of COVID, they, I think, realized that we could do much more. And in fact, we could do things that they couldn't do for these folks who are homebound. And so understanding that symbiotic relationship so that we can serve the homebound and that we have the tools, i.e. the volunteers, the retired physicians, the retired nurses that are still licensed, that we could come together and make a bigger difference when we work together. So it's really COVID that has brought us closer together.
And I think the nature of healthcare is changing. For our Medicaid organization, they are looking and funding those social determinants of health, and they're requiring the Medicaid providers to have a housing support person, to have a food support person, to have a justice involved support people. So and that is happening nationally. It was happening during the Obama administration, that even continued during the Trump administration, and it clearly will expand under the Biden administration. So federally, there are changes being made that integrate healthcare with housing and with food and transportation. And so the nature of healthcare is not just traditional health and acute care, if you will. It is looking at wellness, and that really started with that was built into many of the segments of the Affordable Care Act. So that over the last 10 and 11 years, hospitals and health plans have been integrating that work. So if you are not connected, you should be, because it is in their financial interest. They are reaching out in ways they never did before, because of there's a penalty in the Affordable Care Act if someone is readmitted in 30 days under certain designations, certain illnesses. The hospital doesn't get paid. So it used to be that they would discharge you, would say, go with God and please go see your primary care physician. Now they're calling you, they're making sure you've got your meds, they're making sure you have a safe discharge, because if you come back, they eat that cost. And so that has totally changed the dynamic over the last 10 years.
I think in terms of in general of starting up those strategic partnerships with healthcare and with many other sectors, I think listening is hugely important. You really have to listen intently, particularly for 2 things. One, what is their driver? What is prompting them to want this partnership? What is basically driving them to want to take action? I think it's also critically important to listen to their pain points, because what might be a driver for you could very easily be their pain point. And you really need to be aware of what those are in terms of the drivers and the pain points. You want to mitigate or avoid altogether their pain points, and you want to support their drivers and to be able to speak to that. If you can do both of those things, and you can invite them to add value to your work, and you can absolutely add value to their work, and that's how you maintain those partnerships over the long term.
Thank you. And so related to this idea of strategic partnerships and added value, what role do you think foundations can play in improving mobility for older people, particularly in rural communities, given that we are seeing shifts within the healthcare system and we are seeing increased coverage of resources to address the social determinants of health? Where can foundations plug in? And if you could speak to, the large foundations with a lot of capacity, and then, the foundations that are maybe smaller community foundations that have like $10,000 here and there.
I'll lead on that because we're in the middle of that. We're not totally large, but we're not totally small. And really, the best role you can play is that of convener. People come when we invite them because there's the attachment of money. But what we fund, for example, systems change grants, which are saying one organization cannot come and just apply. It has to be a group. And we say it can't be AstroTurf. It has to be true grassroots and engagement. So if they've just put letters of support together and it's pretty clear they've not worked together, we won't fund that. So we are funding a coalition, a well-run existing coalition that comes together for systems change. That has dramatically changed what we get and what we fund. So, and we often will fund, in fact, Amy and I are working on a housing collaboration. We've helped fund the technical assistance for that group and that coalition to do capacity building and have the coalition itself operate more efficiently. That's not something a government agency will fund, but yet it can be absolutely critical to the success of the coalition doing what it needs to do. So we listened, we said, where are the gaps? And we said, we'll be at the table working with you, but where are the gaps and how do we fill them? But it really is being, whether you're large or small, it's being that convener, I think, that can, in a way that we hold that table in certain ways, that we can make sure that equity is embedded in the work and that non-traditional players are coming to the table. So we use that influence to try and pull people in that may not have really thought about being part of it from the beginning.
Suzanne, that's such a great point, and you are so good at doing exactly that. And so in addition to convener, the catalyst, something else that Suzanne does really well, and something else that's really important, is it's helping to be that connector. And she alluded to that in terms of having the coalitions apply, but it's connecting people to new ideas, to new partners that they might not think of on their own, and that's such a critical role. Two important points too, I think, to add to that. One is that foundations don't have to own this work forever. They can come in, they can demonstrate that proof of concept. They're typically less risk adverse than government, for example. And that's such a critical role. It's sometimes providing that gap funding or that glue. It's that connective tissue, that really makes that project go. But then foundations can then step out of it. We've had great success with foundations helping to catalyze that proof of concept, that seed money. But then after maybe 2 years or less, being able to completely step out of that funding picture. And then government picks it up at that point, because then they can trust it, they know that it works, and they know what they're getting for their money. So foundations really play a critical role in that. The other thing to remember is that you don't have to be a transportation expert to partner in transportation programs. You're bringing your specific skill set to the table, your drivers, your circles of influence, and then other partners are providing the rest. So you don't have to own it forever, you don't have to know everything about it, you just need to be there and help to connect people.
Yes. Thank you, Suzanne. I really understand what you're talking about. And being the convener is really, that's a very important role, isn't it? You're standing in the middle of that table, beckoning everybody to come around the table and wanting them to get together and do this. But, one of the things that, I understand the role of a foundation being in to get something started and they pull away. But I also like when foundations have a real keen interest in watching the outcomes come forward from that work. I mean, I think I think the outcomes are so important. We can't always measure those for just in 1 year's time. Some of those outcomes will be going on for years to come, 3 years, 4 years, and maintaining that level of interest across a couple of years, whether it's funded or just plain interest, still include us in this all the way across, I think is really, really important. I really appreciate that from a foundation very much.
You mentioned vaccination and transportation actually as gateways to other services that people might need. And I think that's really important. And can you talk a little bit about what services you're finding that people need, but also do the AAAs and the community-based organizations and the service providers actually have the capacity to deliver all of the services that you're uncovering people need?
Well, yes. Well, Lindsay, that's really a big question. And what we're finding is that many people come to us because they need to get help either getting online and making a reservation for the vaccine, getting a ride there, or having the in-home team come to vaccinate them. And but we're finding so many other things. It is amazing. And it really takes a lot of capacity. I'm directly involved in that, not just our care coordinator and our retired nurses who go out and do the in-home visits and the assessments, but I have to get involved in it. It's that busy. So we're finding people who shouldn't have been driving who now say, oh, okay, I see you can help me get to my doctor's appointments. Can you give me a ride? So, our trips have gone up by about 40% per month over the last 3 months. That's a pretty giant increase in demand. And we see so many people who need tech coaching, they need help with their pets. Some we've referred to adult protective services, and we just see so many different problems going on. Of course, we do a lot of grocery shopping for people, delivering of food bank boxes, and all of that. And so when we go in, we usually see not only the service they're asking for, but we look inside the home, and you really have to be inside that home to see what's happening. And there it is. There's a half a dozen things, or maybe even more. So it takes a while that we have to be in this with a very long-term commitment. Our commitment has to endure all challenges. And so that's kind of what we all talk about on our staff, with our staff and volunteers. We have to keep going. I know it seems like a lot. It's just overwhelming, right? So let's focus. Let's get that list. Let's take one thing at a time and let's go through this. So it is tough.
Kent, did you have to very rapidly staff up to field all these calls that began to come in? Can you talk about what enabled you to do that? Were there maybe some was there some short-term funding or grants, or were you able to sort of pivot the work that you were supposed to do for one of your funders to respond to the emerging needs of COVID-19?
Right. Well, first of all, we got some extra funding due to COVID from the May and Stanley Smith Charitable Trust and the City of Sedona and the Arizona Community Foundation of Sedona. So all of that really does help. It makes a difference. What we did is we already had a pretty good staff, well-trained and dedicated for our call center, because that's really kind of where all the action takes place, where people call and we do all this arranging. And so we put everybody to full-time and overtime. So it's the first time in the history of the organization we've had to pay overtime like we do now. Probably somewhere in the vicinity of 30 to 40 hours of overtime each pay period every 2 weeks. So that's very new for us and kind of expensive. At the same time, we've been able to further develop some of our volunteers who have that dedication, so they actually do more. So we have several volunteers who now go out and volunteer 5 days a week instead of 1 or 2 days a week. And so I hope we can keep sustaining that for a while and then get more new volunteers in. But It's just been sort of a titration between getting more funding and doing more to stay up with that demand.
I also think it's important to think about braiding funding, and you hear that oftentimes. There's certain things that Medicaid will cover or Medicare Advantage will cover, that if you know that and can figure out, okay, they cover this, we can cover that. The city has a program that may cover this. So it's almost like Amy and I were talking about just the other day, we need to do a matrix. If I'm a veteran and I've got problems, what will the Veterans Administration pay for? What won't they pay for? And then I know where the gap is. What if I'm a family and I'm a grand family taking care of kids and I'm in my 60s? Where are the supports for that? And then you can kind of block out what does get covered and where are the gaps. And then you have a better idea of how do we bring them together. And while I'm transporting them, what organization covers that transportation? But if I'm also providing food and I'm doing a falls assessment, I may be able to work with the local community, the hospital, or the federally qualified health center. So that's why it's so important to bring them together, because they often have different funding nuances that if you bring them together and sort of walk through that, you can then thread that integration in a more appropriate manner.
Yes, very good. Thank you.
That makes a lot of sense. And as a follow-up to that question, Suzanne, I loved that Healthy Communities Framework slide that you presented. And I'm curious, how has that framework changed your funding strategy? You mentioned looking for non-traditional partners. Are there other ways that working from that perspective has changed how you do your grant making?
It has completely changed how we do our grant making, and it has influenced, I'm proud to say, how states and cities are even changing we have infiltrated the thought process of, if you look at the wheel, it is a city government in many cases. Those are different departments in city government, with the exception of healthcare, because some cities in the United States do healthcare, but most cities don't. They see that as a public health kind of a county thing. But if you think about, libraries do health programming, the senior centers do healthcare, EMS and community paramedicine do healthcare. They just don't call it that. But if you were to pull, so we've done programs literally with the city leadership in a city, saying, if you look at health and well-being, where are those city, and we've got data that goes in that by zip code. If you go to the vitalysthealth.org website, we have a data dashboard that's working with a national vendor that gives zip code level data on rent burden, demographic data, education attainment. So we can help cities or communities look at where are those gaps with an equity lens, and how do we address those health disparities. So it has, to give you some framework, the Arizona Department of Health Services has a health improvement plan. 5 years ago, it was the 10 things you die of. It was like, cancer and heart disease and diabetes. It now is health equity, tribal and underserved, social determinants of health, and mental well-being. So even on the state level, the framework has completely changed for that integration of social conditions, so that their funding will be driven in that manner, looking at those integrations for the social conditions.
That's really exciting. Thank you. We are getting to the end of our hour, so I want to close by asking our panelists for some final words of wisdom, one key takeaway that you'd like us to remember. And Amy, we'll start with you.
Great, thank you, Lindsay. And just very quickly, thank you again for hosting this, and thank you to Kent and Suzanne for speaking, and thanks to everyone for coming in. Really do appreciate everyone's time. In terms of kind of the takeaway, is just know there are people really wanting to work with you in all of your communities. There are people who care. There are people who want to take action. There are people who are taking action, but they might need that bit of a boost. They might need that help filling the gap. And everybody signing in today to listen, either today or afterwards with the recording, all of you can play a role in helping to catalyze that action. All of you can help be part of the solutions our communities need so much to make a positive difference in the lives of older adults. Thank you.
Thank you. Kent.
Yes, thank you, Lindsay. And yes, it's really the catalyst role for foundations. You have such leadership and such knowledge. I just hope you just step up and be in the center of it all, jump in the middle of it, and be the catalyst, be the convener. Help us get together and help us stay together too. These collaboratives are so important. We wouldn't have any strength at all if it weren't for all the people that we're working with. And so it's such an important thing. And I appreciate all of you, Amy and Suzanne on the call. I mean, we can learn so much just by working together and being together, even doing this webinar. So thank you so much.
Thank you, Kent. Suzanne.
Break the mold. COVID has been such a disruptor in so many ways. Who'd have thought all these doctors would suddenly be into telemedicine when they have fought it tooth and nail? And so use the disruptions as opportunities to think about things differently and to, work with the business community, work with the faith community, work with those non-traditional people that can be in organizations that can be collaborators, bring them together and say, here's the crux of our problem. As Amy said, what are your drivers? What will hem you in? And how do we burst that open? Because we've seen some very dramatic changes in Arizona where we all are, but that's going on nationally as well. So take advantage of that, the Chinese character that is crisis and opportunity. So look at where those opportunities are from those disruptions.
Thank you, Amy, Kent, and Suzanne for being with us today. I'd also like to thank the John A. Hartford Foundation for their support of today's webinar. We will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio. So watch for an email to be sent within a few days with the links. We have several webinars coming up in the next few weeks, including our next session on May 4th, Unheard Voices, Lifting Up the Impact of COVID-19 on Older Adults at 2 p.m. Eastern. You can learn more at our website, giaging.org. Please follow us on Twitter, Facebook, and our new presence on LinkedIn. And please complete the brief survey that will appear on your screen to help us improve our programming. And finally, thank you all for participating in today's webinar. Please be well.
Thank you. Thank you.